After unprotected sex, taking the right step can protect your health and prevent pregnancy. Here is a nurse's medically informed advice I want to give to you. So the first advice I have for you is stay calm. You heard me right, stay calm. I don't know how this unprotected sex feels for you. It might be the best experience ever. It might be the worst experience ever. But whatsoever you're feeling, in all, stay calm. Because if you are not calm, you won't be able to think clearly. You need to be calm to be able to think clearly. Being stressed out is not going to help you prevent pregnancy. So the first thing to do after unprotected sex is to stay calm. Then take me to the second advice I have to give to you. Get a bottle of water. Drink water. Stay hydrated. See, staying hydrated is very good for your general health. It's very good for your general functioning, especially after a stressful situation, especially after that wonderful exercise, depending on how you see it and depending on your experience. So stay hydrated. Drink a lot of water. Then the third advice I have for you is go and urinate. Yes, though there is not a strong evidence to show that when you urinate after sex, it helps flushes that bacteria out, but I advise you urinate. What is the essence of keeping a full bladder? There's no need to keep a full bladder, just urinate. All right, then that takes me to the fourth point. And the fourth point is avoid douching. Wash the genitals. Yes, after urinating, wash your genitals. It's not good to keep those leftover secretions, your leftover discharges, your leftover fluid semen around your vagina. It's not ideal. So I advise you to wash your genitals. And while washing your genitals, don't douche. Don't put your hands inside your vagina. Don't. It is not advisable. So douching is not going to prevent pregnancy. It is not going to bring the sperm out. I think a lot of people are getting it wrongly. Douching or douching, I don't know how to, but you see the spelling. That's what I'm saying. Putting your hands in the vagina, trying to bring out all the sperm, is not going to prevent pregnancy, especially when you're on your ovulation period. Don't say I did not tell you. Then the fifth advice is observe for unusual bleeding. Unusual bleeding after sex. So when you have this mild bleeding, spotting after sex, it is normal. But if it is severe, if the bleeding is heavy, if the pain is severe, see the doctor. But just observe your general body. Check if you're having severe pain, if you're having severe bleeding, if it is not spotting or mild, then it's something you might need to speak to your healthcare practitioner about. Then the sixth advice I have to give to you is check the condoms you used. Yeah, it's advisable for you to check the condom. Why? Because sometimes you feel you use the condom, it has prevented you from pregnancy, but there's something wrong with the condom. There are holes in the condom broke, or something happens to the condom, and that allows sperm to go into the vagina. So it's also very important to analyze the condom stylishly, just to be on the safer side. And if you did not use the condom or the condom broke, then that takes me to the seventh point, which is get an emergency contraceptive. Yes, get an emergency contraceptive, which is the post pill or the post-pill 2, especially if you are not on any family planning method. That's going to go a long way to prevent pregnancy. And when it comes to emergency contraceptive, it needs to be used within 72 hours. So I've made a video on some reasons, I think 5 reasons why that Postino is not going to work, and I advise everybody to watch it. It's not just taking Postino. You might take it and it's not going to work. So I would advise you to watch that video talking about why that Postino is not going to work. I'm going to leave the video in the description box so you have access to it. Then the 8th advice I have to share with you is track your next period. Especially for those that have regular cycle, they know when they are ovulating, they know when they are seeing their next period. So I advise you to track your period, because when you track your period, you are able to know that, oh, I might be pregnant. You're able to observe for any abnormalities or irregularities in your body. If you are bleeding in between, you will be able to tell. So I cannot overemphasize the importance of knowing your cycle. I've made a video severally on how to calculate your cycle. I'm going to still be leaving the link in the description box below so you have access to that video. All these videos are very important. Then the 9th advice I have to give to you is start observing for any symptoms, any signs of pregnancy, such as nausea, fatigue, breast tenderness. This may indicate early signs of pregnancy. And if you've not watched our video on the 18 early signs of pregnancy, I'm still going to be leaving the link in the description box below so you have access. Because when you start experiencing early signs of pregnancy, it's going to give you a clue to know that, okay, I'm pregnant. You're going to know on time. All right. So that's why it's good for you to note any signs of pregnancy. And while doing that, I usually advise, for example, you've noted your signs of pregnancy. The next thing is to track, when was the last time I had sex? When did I have that sex? And track to see if it's like 14 days after. Because 14 days after the last sex, you can do a pregnancy test. And after your sex, the sex you had, you can do a pregnancy test and it's going to show if it's positive or negative. So you have to track the time you had the last sex. So that's the 10th point. Track time since last intercourse. So that takes me to the 11th point, and that is rest. You need rest. So this one is immediately after. So you need rest after sex. You need to have a good sleep because you've done a lot. Yeah, you've exercised, you've released a lot of calories. So it's time to sleep. It's time to have a rest. Then the 12th point I have to share with you is that if you're having any concern, if you notice anything strange, it's advisable for you to contact your healthcare practitioner. I believe in some countries, they have some sexual health nurses, sexual health doctors that people can actually meet and get advice from and get advice generally in regards to sexual and reproductive health. So I think it's very important for you to contact the healthcare practitioner, get educated and get informed about sex, especially if it is your first time of having sex. But if you notice any abnormality, any irregularity, anything strange, I will advise you to contact your doctor. Like I will always say in most of my video, it is better for you to go and see the doctor and the doctor says, oh, I've done all the tests, everything is fine, than for you to assume everything is fine, stay at home and something is actually wrong. All right, so thank you all for staying tuned. Thank you very much for watching our videos. If you've not watched our videos on the 18 signs of pregnancy, I'm going to be leaving the link in the description box below so you have access to this video. So thank you very much for staying tuned. Thank you very much for watching the video. Don't forget to like, don't forget to subscribe, and also don't forget to share with a friend if you got value. Bye and see you in our next video.